Well, Imantinib is a very targeted treatment for certain types of leukemia. They have to be Philadelphia chromosome positive, and that's done through a biopsy. Once that's determined, what this drug does is actually turns off the intracellular enzyme that is responsible for the abnormal growth of these cells, and so in essence targets the very origin of the cancer in these patients. Well, you know, traditional cancer therapies have been rather crude. These are toxic substances that we find are more toxic to the cancer cell than to the rest of the body, but as cancer patients can attest, sometimes it's a very, very difficult process. This is the result of literally decades of immunology research where we've come to understand the inner workings of the cell. And in this particular set of leukemias, there is an enzyme that malfunctions and it gets turned on, and this medicine helps turn that off and essentially stopping the cancer.
Our estimate is we will probably provide about, say, 30% or even more savings to the healthcare system through launch of this product. And the extent of savings will continue to increase as time goes by. Then the other one is very important, like you're asking. Unlike other generic products or other generic companies, for launch of Imantinib, Sun Pharma, we have launched a website called Imantinib RX, Imatinib RX, that will provide variety of services to the patients. First up, there is a 1-800 number that the patients can dial in, talk to sort of what you say, healthcare providers, experts, who can provide them more information about the product. Ultimately, they have to consult their physician for more questions. On the economic side, we are also providing two types of, let's say, assistance programs or access programs. First is called the savings card. Patients who have a high copay, we subsidize their needs in such a way that they need to pay, let's say, about $10 copay for a month treatment cost. Then for patients, say, a certain level below the poverty line, we offer them drug free of cost. So certainly these programs are very important in our mind to enable good quality access to the product, which is highly relevant for the condition Dr. Charlie Molta explained. My belief is if the patients go and see their doctor today, it should be possible for them to access the product. I think they can go to this Imantinib RX, Imatinib RX, and there is also a 1-800 number to that they can talk to. They'll sort of what you say, they'll get a lot more information. There's a lot of frequently answered questions for which we provide answers. There's sort of patient forms if they want patient assistance. Access to the patient assistance program, they can access that. So that website will be very good for the patients to look into.